Hello, everyone, and welcome to the Metabolism and Menopause podcast. My name is Stephanie, and I am your host and CEO of Vitality OET. We are a women's health and fitness company focusing predominantly on women's hormones, particularly as they go through perimenopause and menopause. We know that so many women struggle with so many symptoms like brain fog, irritability, night sweats, hot flashes, and of course, that lovely menopause belly that just seems to come in out of nowhere. So you go back to your tried and true habits of cutting calories, cutting carbs, doing a ton of exercise, but nothing is working and it just leaves you feeling in a worse state, gaining more weight, and you feel absolutely desperate and hopeless. So our mission is to teach women about what happens to their bodies during this time in their life, what they can do to live a life full of vitality, finally reach those health and fitness goals, and never have to worry about this stuff again. So what we're going to be talking about today is hysterectomies. I have the wonderful Coach Brittany here with me today. And we're going to be talking about hysterectomies, what that means for your health, recovery, surgical menopause, other things you have to be aware of. Basically all the ins and outs that you need to know about hysterectomies because they're incredibly common. So Coach Brittany, thank you for being on here with me today. Coach Brittany has been with the company for a while now, especially by the time that this episode is going to launch. And she is also a doula, which is amazing. So she knows so many things about women's health and women's bodies and how they work. So we're going to chat about this as well as her own hysterectomy story as well. So again, we're going to go through all the ins and outs, how to best support your body. It is definitely a question that a lot of people ask, and there is so much information out there, and it's really hard to know what advice to take, what to listen to. Most people end up feeling incredibly overwhelmed, and they don't end up doing anything, or they just try and go back to what they were doing before, which either hurts or makes things feel worse. They get hurt, movements just don't feel as good, and they just don't feel good about themselves in general. They just feel kind of lost in their own bodies and don't know what to do. So Brittany, why don't you start off by telling us a bit about the different kinds of hysterectomies and a bit more about the surgeries in general?
Yeah. So did you know that almost 500,000 women get hysterectomies each year? And this makes it the second most common surgery among women, with cesareans being the first most common. And unfortunately, there isn't a lot of information out there to help guide us in the best approaches for care for ourselves afterwards. Most doctors and surgeons aren't specialists in hormones, in core, pelvic floor health, and a lot of us aren't lucky to live in areas where we have access to professionals who are knowledgeable in those areas, who can help support us afterwards. So let's start with basics. A hysterectomy is when your uterus is surgically removed from your body. There are different types of hysterectomies. We have a total hysterectomy. This is the most common type. And in this surgery, your uterus and your cervix are removed, but your ovaries are left. And then a history with oophorectomy is what I just mentioned. Your uterus and cervix are removed, but one or both of your ovaries, as well as potentially your fallopian tubes, which is also called the salpingectomy. And then we have a radical hysterectomy. This is when your uterus, your cervix, the top portion of your vagina, most of the tissue surrounding that cervix, as well as pelvic lymph nodes are removed. And this is the most common treatment for cancer. And then lastly, we have what's called a supracervical hysterectomy. And that's when the body of the uterus is removed, but your cervix is left intact and present. So there's lots of different kinds of surgeries, and there's lots of different ways to have each of these procedures. We can go abdominally, and vaginally, laparoscopically, robotically, and they're done for a lot of different reasons. Fibroids, endometriosis, adenomyosis, severe prolonged bleeding, cancer, uterine prolapse, and even complications during childbirth. So there are the basic surgeries.
Yeah, so like some people have hysterectomies, like they can feel super freeing afterwards. Like it can give them a decrease or an absence of pain. It can be life-saving, which is amazing. It can help improve quality of life. And for some people, it can cause sadness or even grieving. Some people find they have many side effects, or others have none at all. So it really just depends. And for most people with a total hysterectomy, there shouldn't be too many hormonal changes since you do get to keep your ovaries. You will still have natural cycles with your hormones, such as ovulation pains, PMS, and other hormonal changes during the month. For some people, they see an increase in ovarian cysts after a hysterectomy, and this can be due to changes in blood supply to the ovaries or possible hormone imbalances from ovary malfunctions in those first few months. The other possibility is if you were using a form of hormonal treatment to prevent ovulation, like birth control, and then stopped after your hysterectomy, you may have an increase in your cysts forming as well. So the most common hormonal symptoms for right after a hysterectomy is unfortunately hot flashes. Mm-hmm. And I think that's something a lot of women experience. And since you still have ovaries, you will still have menopause later in life, typically around the time you would normally start menopausal symptoms. But literature does suggest that for women who've had a hysterectomy without oophorectomy will start menopause about 3 to 5 years earlier than they would have normally. So they'll start experiencing those symptoms a lot sooner. So if you've had a hysterectomy with an oophorectomy, so removal of those ovaries, then you will go into a medically induced menopause right away, so surgical menopause. The ovaries produce estrogen, progesterone, and testosterone, and the sudden drop in these hormones can cause hot flashes, vaginal dryness, mood changes, sleep issues, a loss of libido, brain fog, weight gain, painful intercourse, so many things, because all of a sudden you go from having hormones to a severe drop. Studies also show that hormones in the ovaries are helpful in preventing osteoporosis, heart disease, aging skin. So once ovaries are removed, the risk of these complications or symptoms will also increase, which doesn't sound super awesome. Everyone's like, yeah, I've had that and it sucked. Or, oh, I'm supposed to have that. I don't know if I want to do that anymore. Yeah. And I know that sounds pretty terrible. So Brittany, what can we do to help support our body's hormone production once this happens?
Yeah, it's a lot of different symptoms that can happen. And I think that's the biggest question that a lot of people have is if I'm going to go through this, what can I do to help support myself, right? So even if you've had an oophorectomy, so you no longer have your ovaries, there are other glands that we have in our body that can support with hormone production. Our adrenal glands, our fat cells, there's lots of other cells that are still producing hormones in the body. And so it's super helpful to support your adrenals during this time. And really, honestly, supporting your adrenals anytime is the best thing that we can do. So the best thing for adrenal health is also typically the hardest thing for most people to do. It's improving sleep quality and quantity. It's finding yourself a great sleep schedule and sticking to it as much as possible, even on the weekends, which is pretty hard for most people. Sleeping in a completely dark room. So no lights, no night lights, no open curtains to let street lights in, no TV lights, trying to employ blackout curtains if possible. The only time I actually recommend sleeping with curtains open is if you're going to do something called moon bathing or moon cycle syncing, which is super helpful for those who have ovaries and are still having hormone cycles, but aren't having periods to help kind of guide us where we're at in our cycle. And it's really helpful for those who are in menopause because it can give a cycle and a rhythm to the month. And your energy naturally typically ebbs and flows with the moon cycles. The other thing that we can do is get sunshine throughout the day. Most importantly, though, within that first hour of waking in the morning. And I'm going to let you touch on stress because I know how much you love that topic, Steph.
Yeah, so I love talking about cortisol and stress. Everybody knows this. It's my favorite. But trying to cut out stress in your life wherever you can cut it from and try stress reduction techniques like breathing exercises or meditation or yoga. And for me personally, meditation is just it's not calming. It actually stresses me out more, if that makes sense. Yeah. But it's really challenging for me. But there's lots of other things that you can do. And it's really important to be aware, your adrenal glands can do well with some supplements and vitamins to help support it. But if you're not doing things proactively to help with your stress levels, like eating enough food, having enough carbohydrates, focusing on that sleep, taking time to actually recover, not doing crazy amounts of high intensity exercise, the supplements won't do much. So you need to make sure that you're doing other things first before trying to do supplements. They can help, but they'll only take you so far if you're not addressing everything else. So some supplements that can be really helpful in supporting adrenal health can be things like a vitamin B complex, adaptogens like rhodiola and ashwagandha. The thing about ashwagandha that you do want to be aware of is that it does have contraindications if you're on thyroid medications. So that's something to always make sure you check with your doctor if you're on thyroid meds before taking ashwagandha. And then other herbs like lemon balm, oat straw, vervain, skullcap, and lavender can also be helpful. You can also try balancing your hormones, which is especially helpful for those who still have ovaries. And even for those who do not, supplements like black cohosh can alleviate symptoms brought on by the drop in your hormones. And things like chaste tree berry, calcium D glucarate. I suck at saying these all the time. I try to talk too fast. And DIM can also help fill in the gaps where your ovaries aren't producing the hormone information. And I know a lot of women have this question. So Brittany, what about HRT, hormone replacement therapy?
Yeah, I think that's a hot topic. A lot of people have that question. Bioidentical hormones are a great option for some people. You can have a blood test done to evaluate estrogen, progesterone, and DHEA levels. Those are the really important ones to pay attention to. And then once those are evaluated by a professional, you can have a prescription sent to a compounding pharmacy to have your bioidentical hormones created basically for your needs and your specific profile. So you're not going to be getting things that you don't need or not getting things that you do need. And lastly, there's something also called seed cycling. And it's a great way to support our gut health and our nutrients for optimal hormones. The basic premise is to start eating 1 to 2 tablespoons of sesame or flaxseed on the new moon. And then you eat those every single day. This goes on for 2 weeks. And then on the full moon, you start to eat 1 to 2 tablespoons a day of pumpkin or sunflower seeds. Do that for 2 weeks, and then you start all over again. This will help support estrogen for the first 2 weeks of your cycle, progesterone for the second 2 weeks. And just because you don't have a cycle doesn't mean your body isn't producing hormones at all. So the best way that we can support them is by doing all of these things, right? I think that covers everything about hormones. So what about pelvic organ prolapse?
Yeah, so this is a big one. How do we exercise after a hysterectomy? Like the biggest concern and the real complication, most common in the long term when it comes to a hysterectomy, is the potential for that pelvic organ prolapse. And when I was working as a manual osteopathic therapist, this was something that like I knew about, but I didn't realize how freaking common it was. Like it was crazy. Yeah. So whether that was like abdominal or vaginal, the chances of having pelvic organ prolapse does increase as you age. So what exactly does that mean? What is a pelvic organ prolapse? It's when the organs that live in your pelvis, like your bladder, rectum, cervix, uterus, they come down into the vaginal vault and the vagina. So there are different grades to prolapse and degrees, and some are minimal while others are going to be far more severe and higher graded. And the organs can actually be seen coming out. So Brittany, I'm just going to let you kind of go on because this is definitely your wheelhouse.
Yeah, absolutely. So if you've had a hysterectomy, your uterus is obviously not going to be the organ that's going to be prolapsing, but you still have a rectum, your bladder. If you still have your cervix intact if you had a supracervical hysterectomy, then all of those could prolapse, as well as something called a vaginal cuff. A vaginal cuff is what is created if we have removed the cervix along with the uterus, right? The reason is that the uterus and the cervix are both organs that provide support to all of the pelvic organs along with the pelvic floor. People don't need to have had a hysterectomy to have pelvic organ prolapse, and people don't even need to have had a child or given birth to have pelvic organ prolapse, but it does increase our chances. So the risk factors of pelvic organ prolapse are vaginal childbirth, birthing a bigger baby, frequent constipation, genetic predisposition, menopause, excess weight and obesity, chronic coughing, prior pelvic surgery, running, and high-intensity workouts with lots of jumping. So this isn't to say that if you have these risk factors or you have done these things that you're absolutely going to have pelvic organ prolapse, but it can increase the chances of you developing it. And as we age or we go through menopause or even lose our ovaries to a hysterectomy, then we're also at an increased risk due to the drop in estrogen, drier and thinner vaginal tissues, and just loss of elasticity in general. So what can we do to with preventing pelvic organ prolapse, Steph?
Yeah, so the single most important thing that we can do with helping prevent pelvic prolapse is to work on our pelvic floor health. Pelvic floor can be hypertonic or tight, or hypotonic, which is not as strong. So just because something is tight doesn't mean that it needs to be released. It could actually be tight and weak. Like there's so many different combinations, and this is why getting assessed properly is super important, and just being proactive about it as well, like doing whatever you can. And because both of those options can lead to issues. And having a tighter pelvic floor, again, does not mean that you won't have pelvic floor issues, because things can be tight and weak or compensating for other areas that aren't doing their job. So it's equally important that our pelvic health or our pelvic floor is strong, as well as also being able to be mobile and to be relaxed. We need it to respond in the way that we need. So for example, holding in urine when necessary, so you're not peeing your pants, but then also being able to go to the bathroom and being able to relax and actually be able to pee. So often we are told to do Kegels, which it will, and supposedly it'll help with your pelvic organ prolapse and leaking of urine. But to be honest, we're never taught how to correctly do them. Usually doctors will just tell you, hey, just when you're peeing, try and stop peeing and then start peeing and just repeat. But I'm going to let Brittany rant on this, because this could be a lot.
This could be a whole podcast in and of itself. Honestly, I have worked in women's health for 22 years, and it drives me insane to hear how Kegels are told to be done. But I've heard from clients over the years that doctors have told them to practice as much as 100 times a day with Kegeling. This really only helps with one aspect of urinary dysfunction. It really only helps work the sphincter around the urethra, and that's about it. So the pelvic floor is way more than that. It's 14 different muscles. It consists of the levator ani, the coccygeus, the transverse abdominis, our obliques, the multifidus, our hips, glutes, diaphragm. We also have fascia in there. It's organized into 5 distinct layers, and all of that comes together to make this pelvic floor. And practicing Kegels in the way of just starting and stopping urine can cause other issues like overly tight pelvic floors and glute gripping. And that happens when we do Kegels incorrectly. And the following exercises are ones that have really been shown to be more beneficial for strengthening the pelvic floor than Kegels. They will not only give you pelvic floor health in general, but they're super important after a hysterectomy. These exercises are safe to start within 7 to 10 days post-op, but it's always important to see how you feel. Importantly, these exercises are not only helpful immediately after hysterectomy, but these also work if you're years past your hysterectomy. So let's cover them.
Okay, so the first one is core and floor connection breathing. So this is different than diaphragmatic breathing in that your focus is to fill up the lungs and feel the ribcage expand as you inhale. And then when you exhale, the thought is to pull your belly button up towards your heart and into your belly. So it's almost like a bit of like a J shape almost. So in and up. And you should feel the lift of the pelvic floor as well, almost like an elevator coming up and then coming back down. So it's almost like you're breathing up and in and then down and out, if that kind of makes sense.
Yeah, absolutely. And then the flip side to that is that diaphragmatic breathing, right? It's also called belly breathing or abdominal breathing. And the focus there is to breathe fully into the abdomen instead of that chest. Most people breathe in their chest only, and we don't actually fully take deep breaths. Diaphragmatic breathing helps us deepen our breathing abilities, and it helps our pelvic floor lengthen and relax, and it helps activate it when we exhale. And it's just in general good for core strength. We also have other exercises like pelvic tilts. We have glute bridges. These are 56% more effective than Kegels are. We have heel slides, cat-cow, which everybody who does yoga is super familiar with that one. Something called an inner thigh ball squeeze, and that's literally exactly what it sounds like. You put a yoga or a Pilates ball right in between your inner thighs, you're laying down and you squeeze and it contracts it helps contract your pelvic floor and your abdomen. Transverse abdominis contractions. There's clamshells, which are 25% more effective than Kegels. And then we have things called the mermaid stretch and thread the needle, which are both really important to help with lengthening and keeping the pelvic floor mobile too.
Yeah, and typically we also recommend starting with gentle walking about 7 to 10 days post-op, and then increasing by 5 minutes every week, depending on how you feel. That's just a suggestion. You really want to listen to your body here. Rushing the process is not going to help you. Once you are past that 6 to 8 week mark, you can start adding more to your workouts. This is a great time to start increasing your time walking every few days. You can add in some strengthening exercises that will help to support your pelvic floor. The biggest part here is to really make sure you're incorporating all the breathing exercises you worked on before. You want to prevent as much pushing out or bearing down and breath holding as possible, especially when adding to the exercises, like you're adding more gravity, load, weight, that kind of stuff. You really want to be mindful of that. Make sure to exhale on the hardest part of the movement. So for example, if you're doing a squat, while you're going down into your squat while breathing in and then breathing out as you're coming up. So exercises that can really help with this kind of stuff are lunges, which I know everybody hates lunges, but like they're so good for you. Yeah, you guys, like I hate them too, but I still do them because they're so beneficial. They're 42% more effective than Kegels. 42. Squats, 30% more effective than Kegels. There's deadlifts, banded pull-aparts, banded lateral walks. That's where you have the band around your knees and you're kind of just sidestepping side to side. Abdominal marching. Banded glute bridges, being on all fours, quadruped, and like hovering. So doing like, I like to call it like a bear crawl plank, like you're on your hands and knees and you lift your knees off the ground. That's 49% more effective than Kegels. 49. And it probably feels better too.
Yeah.
Plus it's going to help like your whole body. And the goal in exercising after a hysterectomy is to take it slow, and make the first part really all about rehab, then rebuild and retrain. So you have to do it in that order because it will not work otherwise. And you're going to end up with like injuries and just not feeling well, having a hard time activating musculature, all that kind of stuff. Once that's done, you can go back to running, lifting heavy, CrossFit, anything else that you want to do. But it's crucial that you take the time to allow your body to fully heal and build that connection and strength in your pelvic floor, core, and back to protect you once you get back into those harder things. It's very important. And Brittany's going to talk here about like scar tissue stuff, but that's huge. Like you don't realize how hard it is to connect to musculature after there's been incisions and stitches and all that kind of stuff. It really inhibits your body's ability to connect neurologically to those muscles to get things to fire up. So the rehab process is super important for that reason alone.
Yeah, it is. And I'm really glad that you mentioned scar tissue. I don't think that it's really covered enough. And going back to like, also this applies to cesarean section too, being the first most common type of surgery for women. So this is really important. Whether you've had like a full abdominal hysterectomy, a robotic hysterectomy, even a vaginal hysterectomy, adhesions and scar tissue are super, super common, and they can cause a lot of pain, pulling sensations. If you've had an abdominal hysterectomy, it can cause dimpling around the incision site or the scar itself. And the best way to deal with it is through hands-on massage. There's really no other way to do it. So take time out of your day. I know it can be really hard for us to take a couple minutes to do this ourselves, but taking the time, laying down, using a lot of oil, get your hands nice and oily, so that way you can really deeply massage your scar tissue and adhesions. It might have to be gentle at first, and you might have to build up from there, but it will help break them up and help with pain and pulling sensations. The more you massage, the more you'll break up all of that scar tissue. I typically recommend that people start with a few minutes a day and work up from there for anywhere from 7 to 10 minutes a day. You don't have to do it forever. It's just until you feel those adhesions and scar tissue kind of break away, right? So this isn't like, now I have to do this every day for the rest of my life. You want to work the incision area also in all directions. So that way you can get the different areas of scar buildup. So we want to go up and down. We want to manipulate from side to side, diagonally. And then with hand motions, in a straight up and down motion, circular motions, all different kinds of ways, because adhesions and scar tissue build up in all different kinds of patterns. I hope it's helpful for those who have some scar tissue pulling and build up.
Yeah, and you can use this for like scars anywhere. Like this is something that I used to treat a ton in like my osteo practice was scar tissue. And it's so prevalent. It's kind of crazy, honestly. And like a different way too that you can do like more fascially almost is like, let's say you have a scar on your arm. So if you're on YouTube, you can see me. You're going to like put pressure and then just slide across, but you're not letting your fingers like slide across the skin. You're just going until like there's tension. And then you just keep pushing in that direction. Eventually you'll kind of let it, like it'll kind of feel like it's letting go. And you can go in all directions, like horizontally, up and down, pulling the scar apart, going diagonally. Because again, scar tissue isn't just like right on the scar, like it's going to be all the way around. So trying to open that up as much as you can to allow blood flow to come in. Some scars can be pretty painful. So start out really lightly. I definitely recommend you doing it yourself if it is something that's quite painful, because having someone else do it can just be like a bit much sometimes or too stimulating. Yeah. So learning to be able to do it on your own is very helpful. So some more questions here. I just want to touch a little bit more on like the surgical menopause really quickly. It's people are like, how is this different than regular menopause? Since you do the same things. It's a lot more drastic. You don't get to ease into it. You go from having a lot to none. So this is where like your symptoms are going to be far more aggressive and your adrenals really try to pick up the slack for you. But if you're a person who's very go, 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 you're stressed out all the time, you're not sleeping enough, you're not eating enough, you're eating low carb, you're rushing around all the time, you've got financial stress, work stress, deadlines, all those things, it's going to cause your cortisol to go up. And when cortisol goes up, it's going to decrease progesterone production further. It's going to affect your estrogen levels further, your testosterone levels further. It's going to increase your insulin resistance, inflammation, decrease your thyroid function. All these things that are going to like further want to put your body into like fat storage mode. And it's also going to result in more aggressive hormonal symptoms. So really trying to control cortisol is going to be super, super huge. And the first step in trying to bring your hormones back into alignment, because things like, if let's think it's like up and down, you have like estrogen on this side, progesterone's low on this side, we have insulin's really high on this side, and we're trying to bring everything back to the normal levels where it needs to be. So that's where your body is going to be able to adapt or be able to like respond to the stimulus we send it in like a fat loss phase or things like that appropriately, because otherwise you're just adding stress to a very unstable, unaligned system, and it's not going to result in the changes that you're wanting. So this is where, like, again, making sure we're eating enough, focusing on recovery, getting your sleep under control, all those things are really going to help with cortisol and really balance things out for you. And just help with those symptoms. If you're having a ton of crazy symptoms, just adding more stress by eating less, moving more is going to make things worse. So number one is addressing your health, realigning those hormones as best as we can. And then you can go into a fat loss phase after. So if this is something that you guys want help with, please don't hesitate to reach out. Like we will always answer, help you calculate like where you should be, give you a rough estimate of where calories should go, how to get there, how many carbs, all that kind of stuff, strategies to implement. Like you can always message, we will always answer. But Brittany, I want to ask a little bit more about your journey, because I know you had a hysterectomy. So tell us a little bit about why that happened. How was your recovery? How were you feeling after? All those things. Tell us everything.
Yeah. So I had a hysterectomy when I was 35 years old. It's been almost 6 years since I had it. And it was actually as a joke. My doctor, I mentioned it as a joke. I have had endometriosis for, as long as I can remember, and it's progressively gotten worse over the years. And I have obviously estrogen dominance with it. So I had really, really, really bad bleeding with each of my periods. My cycles sometimes would last upwards of like 14 days with bleeding. That's just a lot every month. A lot of pain. I would pass out sometimes from blood loss because I was losing so much blood. I magically had 3 babies. I don't even know how that happened, but I was able to have 3 of them. I had a lot of fertility issues and struggles getting pregnant, keeping pregnancies. We had a lot of fertility issues, a lot of losses and miscarriages. And it was at the point where I was just literally laying down on the floor daily because I was in so much pain and so tired from losing blood, and I couldn't play with my two kids at home, my little ones. And I just, it was like, there has to be something else. I've done years of hormone, birth control that were supposedly helpful. None of them helped. The IUD wasn't really a great option because I respond really weird to hormone, therapies and stuff. And it was kind of like, well, you could use pain medication on a daily basis. I'm like, do I really want to do that? Like, there has to be something else. And so I jokingly said, I'm like, let's just take my uterus out. And my doctor goes, we could. And I said, sign me up. We're going to that's really an option for me at this point. Let's do it. And it was about 4 months later, I think around 4 months later, that I got my hysterectomy done. It happened pretty quickly. We also confirmed that I had something called adenomyosis. Adenomyosis, for those who aren't familiar with it, I like to call it the cousin to endometriosis. So as endometriosis adhesions grow on the outside of the uterus and the surrounding tissues, adenomyosis actually grows into the actual uterine tissue itself. And it causes something where it's a term called a boggy uterus, meaning like a uterus that doesn't work properly. So as we have a period, our uterus, while we get cramps, right, our uterus contracts to help slough off all of the endometrial lining, and it helps us bleed. Well, mine isn't working. It's basically like it's got too much adhesions in the actual muscle itself for it to properly work. And basically it also makes childbirth that much more, high risk, because I would be at risk for postpartum hemorrhaging at that point. And so it was a really, really good choice for me. I decided to have a vaginal hysterectomy instead of an abdominal one. The recovery time for vaginal is much, much shorter, but it also meant losing my cervix as well. They took my fallopian tubes. I had a lot of scar tissue on both my fallopian tubes, so they decided to take those, but we left my ovaries. So I did not go through a surgical menopause, but I did deal with a lot of hormonal symptoms at first. My biggest ones were hot flashes, that I got to deal with, and that's super fun. Was a couple of weeks worth of that. And then, I slowly started rebuilding. So I was lucky enough to have the information that I do working in the field that I do, and having like conversations with all the people who work in pelvic health and in fitness, and, we're talking to other OBGYNs and everything, that I kind of had a really good plan for myself, right? Like I knew about needing to rest for a certain amount of time. I knew how I could rehab myself. I knew how I could kind of work myself back up. But for me, I got so caught up in the possibility of having pelvic organ prolapse and what if I hurt myself. And I got so scared that I really, really went like from one end of the extreme to the other, right? Instead of like getting back to it, I was afraid to do anything at all. And so I used rehab for a really long time instead of, I did CrossFit. I was a runner. I liked lifting heavy weights. I liked doing HIIT. And I stopped. I completely stopped doing all of that. And in hindsight, it actually was a really good thing, because then, having kind of like this hormone dysfunction happen, I still have higher estrogen levels. My poor body's trying to figure out what the heck's going on, because we just lost a uterus and all this stuff. And then 8 weeks after my surgery, we moved almost 2 hours from our house where we lived. No family around. We moved from being with family. I got a job working with an OBGYN's office. So I was working 40 plus hours a week on top of doing birth doula work. So supporting families, having babies. So it was a lot on my adrenal hormones. And looking back, it probably was a great thing that I wasn't doing the HIIT and the running and all of this stuff, right? Because my adrenals were completely shot. So while physically I felt better, like I didn't have bleeding, my pain lessened by probably 80%. So I was super functioning. Even my girls were like, wow, mom's playing with us. Like that's new. I've just started feeling like garbage afterwards. I was exhausted. I wasn't sleeping well. I was super stressed out all the time, and I couldn't figure out why. I started gaining weight and I couldn't figure out why. I had never had an issue with weight before that, and hair was falling out and just all kinds of crazy stuff, having really weird dreams all the time, and just anxiety attacks and panic attacks, and really, going back to like the basics and going to a naturopath. I started acupuncture, which was super helpful with the lingering like hot flashes I would get. I was getting some ovarian cysts that were pretty frequent after I had my surgery. It stopped. I stopped having those when I did acupuncture, and just really started from the basics, started working with a naturopath. Okay, what else can we do? What can we do to support? What do I need to shift and change? And it's taken me a couple of years now. It's probably been about 3. And I started working with a nutrition coach myself shortly after that. And just really going back to kind of what we talked about, right? The basics of supporting adrenals and stress management, and making sure my nutrition was on, like I was eating enough. I wasn't at the time, I was eating like 1,400 calories and making, barely any protein, and just making sure that I was having enough food to support my body for what it needed to do. And once I started kind of getting those things in order, everything else kind of started falling in line for me. So it's hard. It's a scary thing to kind of think at 35 years old, I'm not going to be able to have any more kids if I wanted to. And what does this look like? And does it set me up, for pelvic organ prolapse? And is my body going to change? And is my libido going to change? And, cause I think it's just such a big gray area, right? Cause there's so much possibility that can happen with it. You can either come out and you hear stories of people who were completely not affected by anything. They went on with life. Nothing changed for them. You hear people who were completely the opposite, who everything changed for them and they are having a horrible, hard time. And you have these people who are kind of like this middle of the road. And so when you are faced with a hysterectomy, especially at an earlier age, you sit there and you go, great, which road am I going to go down? Which one is this going to be? And I don't have as much control over it as I'd like to. So it's a pretty scary thing, but in the end, I still question it, but like in the end, I think I made a good choice. So,
well, it's always the uncertainty of things. I find that affect us so much. It's like, because when there's uncertainty of like, we don't know what to anticipate, what the outcome is going to be. That's why we panic. We panic with everything. Like if we go into a reverse diet, when we're trying to think of a new career change, potentially leaving a relationship, it's all the uncertainty and the unknown that causes us the most stress and the most grief, and like can just like cause us to be in like paralysis and not change or make a decision or things like that, right? So I don't think this is like any different that way. It's the uncertainty of like what the outcome is going to be like, what life is going to be like. That's so scary. You mentioned like acupuncture, super great for like the cysts and the hot flashes. Tell me a bit about what happened when you started increasing your calorie intake. Like what were the first things that you noticed?
Yeah. So the first thing that I noticed was like my sleep got a lot better. And I stopped having weird dreams all the time. I stopped waking up repeatedly in the middle of the night. I started sleeping for longer. I wasn't waking up starving like I had been, or even waking up in the middle of the night starving. My hair and my skin got a lot better, like less dry, less brittle. And then I think my energy levels were obviously coming back, partly probably because I was eating enough, but also from just that change in my sleep. And then I did notice that my weight actually started to go, like, I don't weigh myself on the scale. I have a history of eating disorders, and it's a really long history and it's very complicated. And so I stopped weighing myself years ago. But I did do measurements because I always think that it's great to be able to see progress in some way, right? And so I noticed that my clothes were fitting differently, that my measurements were changing and going down. And here I am eating more food than I was, so those were the initial things that I saw that changed. And they happened pretty quickly, actually, after I added in more of those calories. So,
which is amazing. And I think the reason, like something that a lot of people forget about is like when we're increasing calories, people just think about their weight. Like 99.9% of the time, people are like, what's this going to do for my weight? Your weight is a symptom as to what's happening in your body. So it's like by eating more, again, we're bringing those hormones back into an alignment so that we're improving your health, so that everything can function better, so that your body can burn fuel more efficiently. Because when our hormones are completely out of whack, we're not in alignment, our body is not efficient at burning calories. So we always focus on like, eat less, move more. That's going to help with your body composition. But that you're just focusing on a symptom as opposed to the true cause, which is typically going to be like hormonal alignment and your metabolism, like what things control that, because that's what's going to cause the change in your weight. So I think a lot of people like panic so much, especially after like a hysterectomy and they have excessive weight gain afterwards. All they want to do is cut their calories. And it's like you're just adding extra stress onto an already stressed system that's already out of balance. That's like, you know, you have like a Jenga tower and what you're trying to do is like put all the blocks back to where they need to be. So it's like strong, sturdy. But when you're like going through all these things, we're slowly pulling things out. So it's a lot more vulnerable to like stress and falling over. So we got to like put all the blocks back. Then it makes it so much easier for your body to be able to like burn the calories efficiently. Like everything's functioning the way it needs to. And I think just people forget that stuff. Like the weight gain is a symptom of something else. So we're not treating the symptom, we're treating the cause. And I think a lot of people, we just panic because everyone just focuses on that, right? Like so much.
Yeah, I think that is really like indicative of like United States healthcare too, is that we just treat symptoms, right? Like we don't actually dig deep enough to find what the root cause is. So it's like, oh, you're gaining weight. Let's put you, like, let's do more movement and less calorie intake, right? Okay, great. I have heard that for years and years and years, and it drives me insane. Here, let's put you on this medication to help you lose weight. Here's some, like the Topamax and the Fen-Phen and all of these things that we do, but that's only treating like the weight gain. Okay. We have to ask, why are we gaining weight? It could be hormonal imbalance. It could be I'm not eating enough calories. It could be my body just doesn't feel safe in what it is, like what's happening, and not eating enough, like you said, is a stressor in and of itself, and people don't realize, like we don't put two and two together. Like if I'm not eating enough food, that stresses out my body. We just think of if I'm not eating enough food is going to make me lose weight.
Yeah. And going through like surgery is traumatic. As little or as big as a surgery is, it's a trauma on your body that is a stress. You're going to have more inflammation. Your immune system's working in overdrive. Your cortisol is going to be high. Your body needs time to heal. So trying to go straight into a fat loss phase after surgery is like the last thing that you should do, because I promise you it will not end well.
No, it will not. Mine did not end well. I was like, well, if I'm not going to work out as much, I'm just going to eat a little less than I normally do. And I already wasn't eating enough to support my body at the time.
Yeah.
And you don't realize, like for me, I felt so good physically after my surgery that I didn't realize the actual stress that went on in my body and all of the logically I knew it, but like because I felt so much better, it was like, oh, it's great, it's fine, I've recovered fine, everything's great. Like I'm not one of those people. Like, we all think we're not one of those people.
We always think we're the exception, right? We're always like, oh yeah, that's not me though. Like that's different. Yeah. It's like, no, it's the same for everyone. No.
Yeah, you're a person, so it's going to apply to you.
Exactly. Yeah. Well, I think that's it. That's all, you guys. We are going to, when we're launching this podcast, there will be actually a guide with all of the exercises that we talked about for improving pelvic floor health, to make sure you're being proactive for that pelvic prolapse risk. It is something that we're like very passionate about. It's something that actually we have a lot of those exercises already in our programs. That's part of our mobility warm-up stuff for that specific reason. So we will have a guide pinned to the bottom that you guys can access. There's going to be links to all the videos on how to do every single exercise as well. So make sure you check that out as well. And if you have any questions on like calculating your calories and all that good stuff, just message me. We'll always answer. Again, thank you so much, Coach Brittany, for being on with us today. And we'll talk to you soon. Bye.
Great. Thanks. Bye.